National Women's Health Week is a time to encourage women to take a moment and pause and take care of others and stop taking care of others and start caring for themselves. And Lindsay Thomas is here with us, who has an amazing story and also going to talk to us about, of course, the Go Red Luncheon. And I have to say, Lindsay, you've always been behind the scenes with HonorHealth coming in, and it's nice that you're bringing your story to the forefront. I didn't even know about. I mean, we've known each other for a couple of years now.
Yeah.
But you had a very, pretty much scary health scare while you were pregnant. Let's talk a little about that story.
Yeah. So I've had 2 babies, but with my first pregnancy, I did have a little bit of a scare. I had some arrhythmias and things like that. And working in cardiovascular services for the last 10 years. It was a very different experience of being on that side of the spectrum. And so really, I think having that experience has really renewed my, commitment to our community and really making things better for our patients, especially our female patients.
Yeah. And so we were talking, and that is when you were pregnant, you were worried about the baby.
Yeah.
You were all concerned about the baby, but really not about yourself. And that's what this was going on, is that you were having fainting spells and trying to figure out what's going on, but you really were concerned about the baby before you kind of was like, okay, maybe I need to go have myself checked out.
Yeah, I think you hit it on the head opening up the segment of we as women are the ones that, on the airplane, right? They tell you the oxygen mask, put yours on first and then put everyone else's on. We forget that step in life. And so we are so focused on everything else around us. And really, once you need to take a step back and focus on you, because you got to realize you can't pour from an empty cup.
Yeah.
So it's so important for us to really listen to our bodies and take control and be our own advocate for our health care.
And this week should not just be one week, it should be always, and that's where HonorHealth comes in, especially when we're talking about heart attacks with women. And it's interesting that over the years, working with you and Dr. Shaw and Dr. Ryzik and everybody, that we're seeing more and more cases of women heart attacks that they've passed off as something else, or the women have pretty much ignored the signs and the symptoms to care for the family because they're like, well, the family can't go on without me.
Yeah. Unfortunately, I think that people in women's health, we get that shift that everyone is so focused on breast cancer and all those things. Well, guess what? 1 in 3 women will die of cardiovascular disease. And that's a scary fact. But the biggest part of that is to know that 80% of all cardiovascular disease is preventable. So that's where it comes into that we as women really need to take control, focus on ourselves, control those things that we can, like our blood pressure, mental health, and all those things really contribute to your cardiovascular wellness.
Yeah, and the Go Red Luncheon is so important, especially this year as we've been coming out of COVID, for people to come and listen to the stories, come and learn, and pretty much take a pause from everything and enjoy lunch with other women and enjoy lunch on learning how they can stay healthy.
Yeah, we're really excited this year for the American Heart Association Go Red movement. We're back in person for the first time in several years. And I think this year we're really trying to make it different. It's going to be a true experience for people, and there's going to be lots of different talks and key speakers and physician panels and ways to learn, and also just focus on raising those critical funds for women's heart health.
Yeah. Okay. Let's give a tip out right now as we get to wrap up. 2 moms out there, since you are one, and you're a working mother, and you know how important it is to make sure the family's good and everybody's good. But what about mothers? What should they be doing for themselves right now?
I would say the biggest thing as a female is know your numbers. First thing in that, know your blood pressure. I know that we as women don't think that as a 30-something-year-old woman you should know your blood pressure. It's really important. It's a really good indicator to all things, mental health, but most importantly, cardiovascular health.
Yeah.
So.
Can I also put one in there, and that is share your information with somebody. I think you guys hold it so close to your vest that you don't want to share anything with anybody, and then we don't know, especially your husband or your children, when something happens to you. You need to share those.
Don't minimize your symptoms. Listen to your body. If you're not feeling good, go get checked out. We have all kinds of people that are there for you to help you and guide you along in your journey and really create that personalized plan for you. So. Yeah.
I appreciate you coming in your very busy schedule this week. I know you've been very busy. Very quickly, tell people where they can find out more information about women's health.
Yeah, so honorhealth.com/women's heart. And then also for the Go Red for Women Luncheon, it's the American Heart Association website for the local chapter.
Perfect. Well, thanks for coming in.
Thanks, Brad,
thank you. She's always behind the scenes, so I like her coming in. So
yeah,
thank you.
This is fun.